What is antibiotic prophylaxis for sickle cell patients? Antibiotic prophylaxis is an important preventive measure for individuals with sickle cell disease. This treatment primarily involves the use of antibiotics, especially penicillin, to help reduce the risk of serious bacterial infections. People with sickle cell disease are more vulnerable to infections due to the damage to their spleen, which is crucial for fighting certain bacteria. This condition can lead to functional asplenia, meaning the spleen does not work properly, increasing the risk of infections from encapsulated bacteria like Streptococcus pneumoniae. To protect against these infections, antibiotic prophylaxis usually begins early in life, typically between 1 to 3 months of age. The standard recommendation is to continue this treatment daily until at least 5 years old. Some patients may need to continue taking antibiotics for a longer period or even for life, depending on their medical history and spleen function. The most common regimen involves taking oral penicillin V twice daily. For children under 5 years, the usual dose is 1 to 5 milligrams twice a day. For those older than 5, the dose increases to 250 milligrams twice daily. If a child cannot tolerate penicillin or if it is unavailable, alternatives like amoxicillin or erythromycin may be used instead. It is crucial that all children diagnosed with sickle cell disease start this prophylactic treatment as soon as possible, ideally right after diagnosis through newborn screening. The duration of antibiotic prophylaxis generally lasts until the child reaches 5 years of age. After this age, the treatment may be stopped if the child has received the appropriate pneumococcal vaccinations, has no history of severe pneumococcal infections, and is under regular medical supervision. However, some children who have had a splenectomy or recurrent invasive pneumococcal infections may need to continue their prophylaxis indefinitely. Research shows that antibiotic prophylaxis significantly reduces the risk of serious infections and mortality in sickle cell patients. However, adherence to this preventive measure can sometimes be low. This highlights the need for ongoing healthcare engagement and education for families and caregivers. In summary, antibiotic prophylaxis for sickle cell patients is a well-established preventive strategy. It involves daily use of penicillin or suitable alternatives, starting in early infancy to protect against life-threatening bacterial infections, particularly pneumococcal disease, until at least 5 years of age or longer if clinically indicated. Always consult healthcare professionals for personalized medical advice and to ensure the best care for individuals with sickle cell disease.